Sarah limped into my office one morning, barely able to put weight on her right foot. She'd been dealing with plantar fasciitis for 18 months. 18 months of that stabbing heel pain every morning. 18 months of avoiding her morning walks. 18 months of cortisone shots that worked for a few weeks, then stopped working altogether. Her orthopedic surgeon had rescheduled her for a plantar fascia release surgery in 2 weeks. She was terrified, but felt like she had no choice. Dr. Schneider, she said, I just want my life back. 3 months later, Sarah ran her first 5K in over 2 years. No surgery, no ongoing pain medication. Her body had actually healed the damaged tissue that was causing her pain. My name is Dr. Andrew Schneider, and I'm a podiatrist here in Houston, Texas, where I've been treating patients for over 25 years. In that time, I've watched the field of medicine evolve, but nothing has me more excited than what I'm about to share with you today. But before I do, please take a moment to like this video, hit the subscribe button, and share with anyone who's been told surgery is their only option. I also want to offer you my complete audio course on regenerative medicine, absolutely free, at regmedcourse.com. This comprehensive course reveals everything you need to know about these breakthrough treatments. You may know exactly how Sarah felt. Maybe you wake up every morning and before your feet even hit the floor, you're already bracing for that first step. Maybe you've stopped doing activities you love because of persistent foot and ankle pain. You've probably been down this road. First, you've tried rest and ice. When that didn't work, you went to your doctor who prescribed anti-inflammatory medication. When the pain came back, you got cortisone injections. Maybe they helped for a while, but the pain returned, sometimes worse than before. Eventually, someone mentioned surgery, and now you're faced with a choice that feels impossible. Live with chronic pain or undergo an invasive procedure with weeks of recovery time and no guarantee that it will work. Here's what's really happening in most medical offices. Doctors are trained to think in terms of medicate or operate. If medication doesn't work, the next step is surgery. But what if there's a third option that most doctors never mention? What if instead of just managing your pain with drugs or cutting into healthy tissue with surgery, you can actually heal the damaged tissue that's causing your pain? That's exactly what happened with Sarah. And that's what I see every day in my practice using something called regenerative medicine. Let me explain what I mean by true healing, because this represents a fundamental shift in how we approach chronic pain. Traditional medicine focuses on symptoms. Your heel hurts, so we give you an anti-inflammatory medication to reduce the pain. The pain comes back, so we give you a cortisone injection to temporarily shut down that inflammation. When that stops working, we consider surgery to cut away the damaged tissue. But here's what's really happening. We're never actually healing the damaged tissue that causes your pain in the first place. Think about it this way. If you had just a cut on your finger, you wouldn't just take pain medicine and hope it would go away. Your body would immediately start the healing process. Blood would clot, new skin cells would grow, and within days, the cut would be completely healed. Your body has an incredible capacity for self-repair. The problem is that some tissues, particularly tendons, ligaments, and the thick bands of tissue in your feet, don't heal as easily as skin do. They have poor blood supply, which means fewer nutrients and healing factors reach the damaged areas. That's why conditions like plantar fasciitis or Achilles tendonitis become chronic. The tissue damage persists because your body's natural healing response isn't strong enough to fully repair it. Regenerative medicine changes this equation completely. Instead of just managing symptoms, we jumpstart and amplify your body's natural healing processes. Regenerative medicine works by giving your body the tools and signals it needs to repair damaged tissues more effectively. In my practice, I use several different approaches, and I want to give you an overview of the main ones that we'll be exploring in this series. First, there's shockwave therapy. This uses acoustic pressure waves, not electric shocks, to stimulate healing. These pressure waves increase blood flow to injured areas, break up scar tissue, and trigger the release of growth factors that promote healing. Then we have PRP, or platelet-rich plasma therapy. This involves drawing a small amount of your own blood, concentrating the platelets that contain powerful growth factors, and injecting this concentrated healing solution directly into the damaged tissue. We also use advanced treatments like DPMX, which utilizes Wharton's jelly from the umbilical cord tissue. This provides a rich source of growth factors and structural proteins that can help to rebuild damaged tissue. Red light therapy, or photobiomodulation, uses specific wavelengths of light to energize cells at the mitochondrial level, reducing inflammation and accelerating healing. And we have therapeutic peptides like BPC 157, which works at the cellular level to enhance tissue repair and reduce inflammation. What all these treatments have in common is that they work with your body's natural healing mechanisms rather than against them. They're designed to address the root cause of your pain by actually healing the damaged tissue. Here's what most people don't understand about chronic foot and ankle pain. Once tissue gets stuck in the cycle of incomplete healing, it becomes progressively harder to fix. When you first injure your plantar fascia or Achilles tendon, your body immediately tries to heal it. Blood flow increases, inflammatory cells arrive to clean up damaged tissue, and growth factors are released to stimulate repair. But here's what's really happening in chronic conditions. This healing response often becomes inadequate or stalled. The tissue remains in a state of chronic inflammation without progressing to true healing. It's like having a construction crew show up to repair your house, but they only have half the materials they need. They can patch things up temporarily, but they can't complete the job. Over time, the patches start failing, and the damage gets worse. This is why cortisone injections provide temporary relief, but don't solve the underlying problem. Cortisone reduces inflammation, which makes you feel better temporarily, but it doesn't provide the materials your body needs to actually repair the damaged tissue. Even worse, repeated cortisone injections can actually weaken tendons and other soft tissue over time. You're trading short-term relief for long-term problems. The patients who benefit most from regenerative medicine are typically dealing with conditions that have become chronic, meaning they've been in pain for at least several months, and conventional treatments have not provided lasting relief. Plantar fasciitis is probably the most common condition I treat with regenerative medicine. If you've been dealing with heel pain, especially that sharp stabbing pain when you first step out of bed in the morning, and conventional treatments haven't worked, you could be an excellent candidate. Achilles tendonitis is another condition that responds exceptionally well to regenerative medicine. The Achilles tendon has a relatively poor blood supply, which is why injuries there can be slow to heal with conventional treatments. We also see great results from other tendon and ligament injuries throughout the foot and ankle, arthritis in the foot and ankle joints, and even patients recovering from surgery who want to accelerate their healing. But here's what's really important. The ideal candidate is someone who wants to heal, not just manage symptoms. These treatments require some patience because we're working with your body's natural healing processes that take time. Let me tell you what my patients love most about regenerative medicine treatments, because the differences from conventional treatments are remarkable. First, these are minimally invasive in-office procedures. Most treatments take 30 minutes or less, and you can walk out of the office and return to your normal activities the same day. Second, there's little to no downtime. You're not looking at weeks in a boot or on crutches like you would with surgery. Third, because we're using your body's natural healing mechanisms, the side effects are minimal. With PRP, we're using your own blood, so there's virtually no risk of allergic reaction. Fourth, many patients find they can reduce or eliminate their need for pain medicine. Instead of masking the pain with drugs, we're actually healing the source of the pain. But here's what's really different. The results tend to be lasting because we're actually healing the damaged tissue rather than just temporarily reducing inflammation. The results aren't immediate like they would be with a cortisone injection. Regenerative treatments work by stimulating your body's natural healing processes, and that takes time. Most patients start to notice improvement within 2 to 4 weeks, with continued improvement over several months. Let me explain why regenerative medicine works so well, because understanding this can help you make an informed decision about your treatment. When tissue is injured, your body initiates a complex healing response. Blood vessels dilate to bring more nutrients to the area. Inflammatory cells arrive to clean up the damaged tissue. Growth factors are released to stimulate the formation of new, healthy tissue. Stem cells are activated and migrate with the injury site to help with repair. The problem is that in chronic conditions, these healing responses often become inadequate or stalled. The tissue remains in a state of chronic inflammation without progressing to true healing. Regenerative medicine treatments work by reactivating and amplifying these natural healing processes. It's like giving your body's repair mechanisms a powerful boost and the right tools to complete the job. For example, shockwave therapy creates microtrauma that triggers a fresh healing response. It's like hitting the reset button on your body's repair mechanisms. PRP delivers a concentrated dose of growth factors directly to the injured area. These growth factors signal your body to send more healing cells to the area and stimulate the formation of new blood vessels. What's particularly exciting is that these treatments often work synergistically. When we combine different approaches, we can create an optimal healing environment that addresses multiple aspects of the repair process. Let me share what patients actually experience with regenerative medicine because the results speak for themselves. Remember Sarah from the beginning of this module? She's not unique. I see similar transformations regularly in my practice. Just last month, I treated a construction worker who's been dealing with Achilles tendonitis for over a year. He was considering changing careers because he couldn't handle the physical demands of his job. After a series of regenerative treatments, he's back to full duty without pain. Another patient, a teacher, who'd been suffering with plantar fasciitis for 3 years, told me that after treatment, she could stand and teach all day without the constant heel pain that's been making her job miserable. What I love about these results is they represent long-term healing, not just temporary symptom relief. We're not masking the pain with medication or providing short-term relief with cortisone injections. We're actually healing the damaged tissue. Clinical studies support what I see in my practice every day. Research shows that regenerative medicine provides significant pain relief in 70 to 80% of patients with chronic foot and ankle conditions, with results that are maintained long-term. As we wrap up this introduction to regenerative medicine, I want you to think about Sarah's story again. 18 months of chronic pain, scheduled for surgery, terrified about her future. 3 months later, running her first 5K in years. What if you could actually heal the source of your pain instead of just managing it? What if you can get back to the activities you love without constantly worrying about when the pain will return? Regenerative medicine offers a third path between living with chronic pain and undergoing surgery. It's about working with your body's incredible capacity for self-repair, giving it the tools it needs to complete the healing process. Please take a moment to like this video and hit the subscribe button so you don't miss the rest of the series. Share this video with anyone you know who's been told they just have to live with chronic foot or ankle pain. And don't forget to get your free audio course on regenerative medicine at www.regmedcourse.com. This comprehensive course goes even deeper into these treatments and will give you everything you need to know to make an informed decision about your foot health. Thanks so much for watching and have a great day.